RAS-Q is a blood gas exchange technology that treats patients suffering from severe lung diseases and specifically COPD. In practical application, RAS-Q is positioned right at the patient bedside, allowing seriously ill patients to be primarily treated in bed. Here at the Aachen-based enmodes startup, Dr. Tim Kaufmann, Dr. Ralf Burchardt and their colleagues work on the gas exchange device of the future. RAS-Q is designed to improve the quality of life of patients suffering from COPD. COPD, or Chronic Obstructive Pulmonary Disease, is the third leading cause of death by disease in the world and is usually caused by smoking, poor working conditions and air pollution. The pulmonary function of COPD patients worsens over the course of 20 to 30 years in flare-ups, so-called exacerbations, to where they are ultimately no longer even able to walk just a few steps. The RAS-Q system works by drawing blood from the patient and pumping it through a gas exchange device using a flow-optimized pulsatile blood pump. The gas exchange device removes CO2 from the blood and enriches it with oxygen. The blood is then returned to the patient. The gas exchange device features an integrated elasticity that mimics the elasticity of the lungs. Constant mechanical ventilation and pulmonary gas exchange are critical care measures that stress a patient's body and can cause permanent damage to the respiratory system, the blood vessels, and the blood cells. RAS-Q is designed to help lower these risks. COPD patients have elevated levels of CO2 in the blood, which lower the pH level in blood. This causes subsequent complications such as an increase in arterial stiffness. RAS-Q technology allows us to adjust the pH upward toward normal physiological levels and sustainably reduce lung damage, especially during acute exacerbations. We are also able to increase patient mobility in acute events, resulting in better clinical outcomes. Today's invasive mechanical ventilation in COPD increases patient risk factors. It causes permanent lung damage, while it still doesn't solve the long-term issue related to CO2. What's more, patients are bedbound because they have to wear a mask all the time and are unable to walk even just a few steps on their own. RAS-Q by enmodes aims to safely mobilize COPD patients since it's designed to be a portable, compact device. The first tests are scheduled for 2020. RAS-Q is designed to offer patients a mobile treatment system, which is why we took a very integrated and miniaturized design approach right from the start. We included numerous clinicians in the development process to address the needs of patients. Unlike conventional systems, we focused our work on COPD, not other lung diseases from the outset. By 2019 mid-year, we want to complete the design freeze in our RAS-Q development. The preclinical studies of the devices are the next step. This is intended to prepare and take safety measures for the first use in humans, which we plan to implement in the middle of next year. After that, the medical device certification will be the next phase.